So I'm not sure if prophylaxis with tocilizumab is wise, and I'm not sure if Anakinra works. So the answer to your question is, for those particular drugs, I'm not sure that either have a real important place as prophylaxis or upfront therapy. Now, they certainly have certainly tocilizumab has a role for the treatment of CRS. I'm not as convinced for Anakinra. But the main thing for prophylaxis is it has to be easy, and it can't affect count recovery. It can't affect other toxicities. It can't affect relapse. And so I'm very sort of enamored by the possibility of giving an antibody to block some of these signaling pathways early on, that the antibody lasts for a while. And actually lasts for 1 to 2 weeks during the high-risk period of CRS. And you also give it once, and the patient can actually be treated as an outpatient. This will save enormous amounts of angst and money in centers that are always worried about reimbursement for patients who have to be readmitted for CRS. So I think prophylaxis, in theory, is a really important advance in the treatment of patients getting CAR T-cell therapies, and keeping people out of the hospital. The cost of treatment will go way down, and also this risk of reimbursement, issues will go away. And so I don't think that Anakinra or tocilizumab per se are the answers, but there may be other antibodies, gamma interferon antibodies, antibodies to CD40 ligand, something else that actually can be given once and takes care of it. The other option is a pill. You take a pill like a JAK inhibitor or something like that for a week or two. That may be another alternative, but those are going to have other side effects and other problems with count recovery.